Hi, my name is Dr. Tsoline Kojaoghlanian. I am a pediatric infectious diseases specialist, which means a doctor who specializes in infections which are contagious illnesses caused by different bacteria, viruses, parasites, and fungi. Infectious diseases 99% of the time are curable, so I wanted to pick a profession where the end result of my caretaking will result in 100% cure for the kids. Infections, as every parent knows, are one of the most common illnesses that a child faces during their life. The kids that I see both in the hospital and in my clinic tend to have more of the severe, complicated, serious infections. These infections can occur both in healthy children, most of the time actually in healthy children, but we also are specialized to see kids with cancer or with certain immune deficiencies in whom unfortunately infections happen very frequently and very often. We all know that medicine and science are evolving fast. There is a lot of information coming at us at all times, and now the general public also has a lot of information at their fingertips. Our role is to make sure that we sift through all this data, we can compare and contrast what's good data and what's not scientifically sound data. We in infectious disease are doing a lot of preventative work, not just preventing infections, but also preventing what we are very alarmed about, which is antibiotic resistance. So a lot of our jobs is to educate as well families as to when to stop antibiotics and when not to give antibiotics, because unnecessary antibiotics can cause much more harm than good. Ever since I was in grade school, I was fascinated with biology and science and already started dreaming of becoming a doctor when I grew up. And luckily that fascination continued throughout high school, and I achieved my dream of becoming a physician. And I chose pediatrics specifically because I just wanted to put a smile on a kid's face, and that has made my professional career very rewarding. I speak 5 languages, which are English, as well as French, Arabic, Armenian, and Spanish. That comes in very handy at the Maimonides Children's Hospital because we serve not only our native New Yorkers, but a very diverse cultural and ethnic families. We do have multiple subspecialists in the Department of Pediatrics, and they all have had excellent subspecialty training. So our hospital really provides very stellar care to the children in Brooklyn. The most rewarding part of my job is when we sit down and explain to the parents of the ill kids what the condition is. We involve them in the decisions that we are taking about the different treatment modalities that we are going to give their child. And of course, when the child heals and gets well and goes home, the smile on the face of that child and the family is what makes our day as physicians.